என்ன தச்சுட்ட? என்ன ஹலோ ஹலோ
Good afternoon, Sister Monica. Good afternoon, sister.
Good afternoon. Good afternoon. Good afternoon. Sugamano.
Sodane. Sister Sodane.
Welcome, John Michael from Mauritius.
Mauritius.
Thank you. Thank you.
And we have people from all parts of India. Once job secretary has entered, we'll begin.
ഇതൊക്കെ അത് ലിങ്ക് അയച്ചിട്ടില്ല എന്ന് പറഞ്ഞു. അപ്പൊ ഞാനിപ്പോ കൊടുക്കുവാ. ഇതായി.
Jobsargari.
Good
afternoon.
Good afternoon, Father Lenin. Oh, Father, I mean, glad to see you after a long time, Father.
Yeah. Once we left Trivandrum, we have not met. Yeah.
You are in Bangalore now, isn't it?
Right. I am in Indian Social Institute.
No, I know. This is almost now 2 years, probably.
Yeah, it's almost 2 years. Yeah, more than 2 years.
Yeah.
I came in September.
But it's a loss for the people in Kerala who are working in China.
Yeah, I will go back, really.
I was telling Father Lenin that you are a respected authority on child right in Kerala.
Yeah. Today there is a consultation by Commeration in Trivandrum to end violence. Yeah. ICPS.
Okay.
So I will leave this one. I enjoyed that meeting.
Oh, that's why. Okay.
Yeah, Shobha Koshi also attending, Father Philip. And
Okay.
Shall we begin now?
Oh, yes. Sure.
Yeah, I'm ready.
Okay. Directly we'll start the program with the prayer. Dear friends, let me admit some more people. Many are waiting. 1 minute. So hearty welcome for 10th webinar on socio-economic impact of COVID-19 on children. In association with the Lockman's partners and Jesuits in Social Action. We are very happy to welcome you. We will start with a prayer. Prayer is we are taken from the preamble of the Constitutions of India. It is read by Father Pius Antony, Director of Sultanbet Multi Social Service Society, Palakkad. Father Pius Antony.
കേട്ടാലേ നമുക്ക് ഈ ഗ്രൂപ്പുകളിൽ പോകുമ്പോ
1 minute.
എന്തെങ്കിലുമൊക്കെ പറയാൻ പറ്റുള്ളൂ.
I request everyone to mute.
കുറെ കേട്ട് കഴിയുമ്പോൾ നമ്മൾ നല്ല ഫെമിലിയർ ആവും. ഞാൻ ഇതൊക്കെ കേൾക്കാൻ തുടങ്ങിയിട്ട് ഇവിടെ വന്നിട്ടാണ്.
Please, Jasmine,
അല്ലാതെ
could you
എനിക്ക്
mute that?
അറിയത്തില്ലായിരുന്നു, എന്താണെന്ന് പോലും അറിയത്തില്ലായിരുന്നു.
Okay.
Father, all mute കൊടുത്താൽ മതി.
Now,
Shall I begin?
yeah, please begin. We begin with a prayer.
We, the people of India, having solemnly resolved to constitute India into a sovereign socialist, secular, democratic republic, and to secure to all its citizens justice, social, economic, and political, liberty of thoughts, expression, belief, and faith and worship, equality of status and of opportunity, and to promote among them all fraternity, assuring the dignity of the individual and the unity and integrity of the nation. In our Constituent Assembly, this 26th day of November 1949, do hereby adopt, enact, and give to ourselves this Constitution.
Thank you. I request Ms. Ashwati to welcome the virtual gathering.
A warm good afternoon to one and all. And today I am here to welcome you all to this webinar on the socio-economic impact of COVID-19 on children and our responses. First of all, I would like to welcome Father Joy James SJ, the former chairman of CWC, the Child Welfare Committee, Trivandrum, and the former principal of Loyola College, Trivandrum. And he is at present the Vice President of Indian Social Institute, ISI Bangalore, and he will be delivering the presidential address of this webinar. We welcome you, Father. And now I welcome Kumari Anamika Sudhir, and she won the Youth Icon Award for her innovative works, and she will be inaugurating this webinar. And we welcome you, Anamika Sudhir. And now I would like to welcome our resource person, Mr. Job Sagaria, and he is heading the UNICEF office in the state of Chhattisgarh. And we are privileged to have you, sir. And I welcome you to this event. And now I take this responsibility to welcome our Director of ADI, Father Lenin Anthony SJ, and the Associate Director of ADI, Dr. Matthew Ethel SJ, other staff of ADI and Lockmans, and Jesuits in Social Action, Father Anil SJ, the Assistant Director of Tudi Wayanad, and he will be delivering the word of thanks. And I welcome you, Father. And also, I am delighted to welcome all the participants, including the well-wishers, child activists, social workers, research scholars, faculties and students, and people from diverse professions, the various parts of India and abroad. And again, I welcome one and all to this webinar. Thank you.
Now I welcome Father Joy James, the Vice President of Indian Social Institute Bangalore and former principal of Loyola College and also CWC Trivandrum, will be delivering the presidential address.
Good afternoon, dear friends. We are in a very special situation because of the pandemic. Last 8 months, we have not been able to do the normal work which we were doing. And today we are very fortunate and very lucky to get Mr. Job Sakaria for this webinar, because he is an authority in the child issues. He was the head of UNICEF in Chennai and looking after Kerala and Tamil Nadu. That time we were quite closely associated with so many programs. In fact, when he was the director only, we started the Child Right Observatory in Kerala, which was, that's a time that people did not know much about child rights. We were able to network with about 140 NGOs, and we had a number of seminars for them, for the school teachers, college teachers, social workers, NGO heads, and counselors. It was a fantastic experience for us. Then afterwards, of course, he left for Chhattisgarh. I'm sure that his expertise will do a lot of good for Chhattisgarh. He is well known in this area of child and its problems. Regarding the COVID-19, one thing that we are very clear that this has not adversely affected the children at the moment, because the number of fatality among the children due to COVID was much less compared to the other older age people. But what is going to happen is post-COVID period will be drastic for the children, because we know that what happens to their food habits, their school education dropouts, then nutrition deficiency, immunization problem, and all sort of things going to be confronting them immediately after this COVID, once you get all the vaccines available to us. We still hope that we will get it by January, February. And this particular year has been a serious problem as far as education is concerned for the children, because some schools and colleges have started their online program, but we know that only 20% of the children have the, the accessibility to internet. Therefore, almost 80% of children could not enter in the class, and that will definitely affect their the cognitive aspect, the learning aspects, and thereby the child labor will increase, child sexual abuses increase as per the report of the Child Line. So therefore, this would be a very good opportunity for us to understand what is happening and what is the socio-economic impact of this COVID on the children. And I believe that all social workers working with the people directly, especially tribals and Dalits and fishermen and urban community, this webinar will give us a lot of insights and information so that we can plan out something very clearly for these coming days, particularly for the next academic year. With these words, I will conclude. I am so happy to see Mr. Job Sakaria has been a great friend. He has been doing a lot of work in Kerala, and we very respectfully, gratefully remember him. And I'm sure that we will get in touch with his new insights and new information. And thank you very much, and all the best for the organizers, particularly Father Lenin and Father Matthew Artail, all the collaborators of Adi, Logmanch, and other group in Kerala. Wish you all the best. Have a good afternoon.
Thank you very much, Father. Thank you very much. Now, I'm very happy to introduce a young girl, a tribal girl who studies at the 8th standard, who is very popular, and even the BBC has covered her news, and almost all the Tamil paper, Malayalam, Kannada, Telugu, Punjabi papers and the channels are covered about her. None other than our young girl from Attapadi, which is Annamika Sudhir from Attapadi. And interestingly, she is studying at Trivandrum Javaha Vidyalaya Navodaya School. And once school started, once the corona started, she was not able to go to school. She collected her neighboring children and she became a teacher. And she got many awards and so on. So we are very happy to have, as part of Children's Day, we celebrated Children's Day on 14th of November. And this whole week, Children's Week actually. So this week, that is why we have taken the topic, impact of COVID on children. And the right person could be a child. A 13-year-old child will be inaugurating this 10th webinar organized by Adi, Lokmanch and Jessa. So I want to, one more minute, let me take about, let me introduce Annamika. Annamika, I hope you see Could you see this slide? Ashwati, can you see the slide?
Yes, Father, I can
Yes,
see
yes.
them.
So Anamika Sudhir from Attapadi, she will be inaugurating. Anamika in mass media that include BBC and all regional news papers. Kerala girl holds classes for tribal children hit by lockdown. Many newspaper covered. Just one news I have taken, and also she got many awards, including Youth Icon Award from Guwahati, and many from Coimbatore and many parts of Kerala and Tamil Nadu. Already she received awards. Just small girls. She will be inaugurating our webinar. I sincerely, wholeheartedly welcome Ms. Anamika to speak her experience and inaugurate this webinar. Welcome, Anamika. Anamika, you can speak.
Anamika?
Unmute ചെയ്തേ മോളെ. Unmute ചെയ്ത് സംസാരിക്കുക. Okay, you can speak now.
Good afternoon. Father, today's research person, Mr. Joseph, and the participants of this webinar. Good afternoon to all. I'm very happy to be part of this national webinar on children. Thank you for inviting me to inaugurate this national webinar. Before inaugurating, let me introduce myself and I'm Anamika Sudhir. I'm studying extended at the Vidyalaya, Tiruvanaന്തപുരം. Due to COVID-19, I'm at home in Attapadi. Friends, I did not have a smartphone or TV at home for online class. Other kids in my neighboring group also did not have this device for class. That's why I start this class with the neighboring children. 30 kids attend this class. Many kids study in Tamil here. When they want to go to higher studies, the language should not be a barrier for them. I study German as my additional language, so I teach that. I also teach them Malayalam, English, Hindi, and Maths. We also do crafts, drawing, etc. And this class me and the other children feel the regular school. The other children, the classes are held from 9 a.m. to 4 p.m. with the strict adherence to the COVID-19 precautionary measures, such as wearing of masks and the personal distancing. I give assignments to the children to work or while attend my school's online classes. During the breaks, I come back to the classroom and continue teaching. Some villages have libraries and cultural centers with the support of local peoples. I expect the government to prioritize education. This step will mean that education is not interrupted during the pandemic. I feel very happy and proud that many people recognized and appreciated me. BBC also broadcast my news. I also got Youth Icon Award. I request you to support me and other poor children. Thank you for listening to me with the words by inaugurate this webinar. Thank you very much.
Thank you very much, Anamika, for sharing your experience and inaugurating this webinar. Thank you so much. Now let us welcome the resource person, Mr. Job Sakria. Let me speak a few words about him. I hope you all will be happy to know about our special guest of today, that is Mr. Job Sakria. Job Sakria sir is from Kerala, and he heads the UNICEF office in Chhattisgarh. Earlier, he was chief of UNICEF office for Tamil Nadu and Kerala, and before that, he headed UNICEF office in Jharkhand. He has also worked in the UNICEF offices in Odisha as well as Bihar. He headed the UN office established in Kerala for the recovery and reconstruction after the Kerala flood in 1819. Prior to joining UNICEF, Job Zakaria was director in the Ministry of Human Resource Development in Government of India. He managed the implementation and monitoring of education programs of Government of India like Sarva Shiksha Abhiyan, SSA, DPEP, District Primary Education Program, and Operation Blackboard, OB, in the country during 1998 and 2003. An innovative government program on education, Janshala, led by Zakaria, was adjudged as the best social sector program in the world in 2002 by the United Nations. He made a presentation of this program in UN in New York in 2002. And an officer of the Indian Information Service, IIS, Job Zakaria was official spokesman for the government of India Ministries Planning, Program Implementation, Labor and Welfare of Child Development. My dear friends, he also has got postgraduate in Business Administration, MBA, from the University of Gull in United Kingdom. He also possesses a degree as Chartered Accountant from the Indian Chartered Accountants and LLB from University of Kerala. So we have got the right person to speak about child rights or the impact of COVID-19 on children, especially socio-economic impact. After COVID, we are going to face a huge problems, especially the children. So he will be dealing with that. You are welcome to ask your questions or have discussion after the session. So most welcome, sir, Job Zakaria, sir, to deliver your speech. Thank you for accepting our invitation.
Thank you. Shall I start?
Yes, sir. Yes, sir. Yes, sir.
Can you show the slide?
Yes, sir. 1 minute. 1 minute. Yes. Okay, sir. Okay, sir.
Oh, thank you. Thank you, Father. I am. Is my voice is it clear? Coming
Yes, sir.
clear,
Very
and loud?
Very clear. Okay, sir. Carry on.
Okay. So thank you, Father Lenin and Anamika and all colleagues. The topic is on the impact of COVID on children. No, the general narrative is that how much. I mean, if you read the newspaper, you will read reports of how many new positive cases, what is the positivity case, recovery rate, the death rate. I mean, all those, all the details relating to COVID. But what is missed is the impact of COVID on children it's immense, and that is going to affect their life even after 2-3 years. And this is a calamity. I mean, अगर हिंदी में एक विनाशकारी स्थिति है, बच्चों के लिए एक विनाशकारी स्थिति है. So that narrative is not normally talked about. Discussion is on only COVID. So that's my topic of my discussion: how COVID will indirectly affect what we technically call as socio-economic impact of COVID on children. How will it affect them, their lives? That's the topic of this one. Father, next slide.
Yes.
So COVID, we know that COVID is it's a health pandemic, but it is going to be a tragedy for children. This is the biggest tragedy or disaster for children since Second World War. को 1945 के बाद सबसे बड़ा आपदा ये है, सबसे बड़ा tragedy for children is COVID. Now, COVID does not affect children much. I mean, COVID as a pandemic, as a disease, does not affect children much. All the statistics says that in only very small percentage of children are infected. Even if they are mildly infected, and the mortality rate of children out of COVID is almost zero. So, but that doesn't mean that children need not be protected against COVID. Yes, all precautions have to be taken against, they are protected against COVID, but they have a lot of research saying they have some internal immunity against COVID. So they are not directly प्रत्यक्ष रूप में बच्चों में कुछ प्रभाव नहीं है. COVID is not going to affect children. लेकिन अप्रत्यक्ष रूप में indirectly COVID is going to affect them in a big way. I don't want, in English there is a word called catastrophic. I mean, और हिंदी में एक word है विनाशकारी. It's a biggest tragedy the children have faced ever. It is not only a tragedy for humanity. If it's a humanity, it is a much more bigger tragedy for children. Now, whatever we have achieved, I mean, last 20, 30 years, we have achieved substantial progress in many indicators on children. For example, on infant mortality rate, the malnutrition rate, the enrollment of children in school, the sanitation, water, protection. On many indicators, India and all countries have achieved substantial progress. We have reduced death, malnutrition to great extent. Now, whatever achievement we have achieved in the last 20, 30 years could be wiped off by the COVID. And this will continue for 2-3 years. Even if COVID comes to an end today, the impact, the dushprabhav, wo jo COVID ka dushprabhav will continue even for many more years, 2-3 years. And when we say it will affect the children who are in vulnerable families, इसका मतलब ये है children वो जो आदिवासी क्षेत्र में हैं or in the slums or who are economically poor, those children will be the worst affected. Children are affected, worst affected, and worst affected will be children in vulnerable families. So I can संयुक्त राष्ट्र के कहना है ये एक catastrophic है. United Nations says this is a catastrophic for children. UNICEF says children are the hidden victims of COVID. So this is, I want to put the picture. COVID per se is not a problem, but the impact of COVID is going to be a big. I don't know how to exaggerate and put it the gravity of the impact on the children, because that is so much. I don't have a particular word to describe how it will gravely affect the children. Next slide. So I will go by one. I mean, how they are affected in each area. Father, next slide. So first I will take how I will take 5 or 6 areas. One on child health, one on nutrition, then on education, then on poverty. So I will come topic by topic. Now consider about the child health. Now, because of the indirect impact of COVID, the large number of children, additional number of children will die. For example, in India, you may not know that 9 lakh children die. Children below 5 years die every year. So that is a normal number. Now, because of COVID, at least 1 to 4 lakh additional number will die. So 9 lakh is already dying. Another 1 lakh or maybe even 4 lakh. I mean, a UNICEF report says that about 9 lakh children in South Asia. That means South Asia means Pakistan, India, Bangladesh, Burma, in that area, 50%. So 9 lakh children additional will die. Out of that, at least 4 lakh will be from India. So you can imagine that more children will die, likely to die. That's what every research, global research, all this data what I am talking in this today is based on research and data. It's not based on my own some assessments, my own some anecdotal information. It's based on global evidence, whether it's a World Bank, Lancet, WHO, UNICEF, sources like that. So one is the increased number of deaths. Next one is regarding the immunization of children have been affected. So that means, already about 40% of the children do not get immunization. Now, because of the COVID and the lockdown, many children have missed immunization. Even in areas like Kerala, in urban areas, many parents are reluctant to go to hospital for immunizing their children because they are afraid of infecting COVID. So, but that percentage of children who are not going to be immunized is going to increase. Now, what will be the impact if the children already 40% of the children are not immunized? Now, another 20% will not be immunized. So, what will be the impact is, this immunization protects children from 14 diseases. So, they will have more diseases. I mean, more diseases means the biggest killers of children are diarrhea, pneumonia, and measles. Diarrhea may not be there in Kerala, but in North India, there are many areas children die out of diarrhea and pneumonia, and measles, and also malaria. For example, the state I am coming from, Chhattisgarh, a lot of children die out of malaria. Maybe in Kerala, nobody may be dying. The maternal care, I mean, every pregnant woman, because the health of a pregnant woman is also related, also decides the health of a child. So many of the pregnant women, they are supposed to have 4 health checkups. That is called ANC, antenatal checkup, where they are supposed to give TD injection, iron tablets they have to take, consume. So this coverage is already very low. It's only 21%. Now it has further declined because of COVID and lockdown. So therefore, it will lead to more child and maternal death. Then there is another issue of the increased pregnancy, teenage pregnancy, that children below 19 years becoming pregnant, that percentage, the probability is very high. And the home delivery, the delivery of babies in the home, this may not be happening in Kerala, because 100% of the babies are born in hospitals. But that's not the case in North India. बहुत सारे जगह में, छत्तीसगढ़ में एक उदाहरण है, 30% बच्चों का जन्म होता है घर में, अस्पताल में नहीं है. It is not in the hospital. So that number, when you are having the deliveries in the home, then the mothers and the children are at a greater risk. So in short, if I want to tell this slide on child health, the COVID indirectly, even if COVID comes to an end today, next 2-3 years, it will affect child death, and more children will die if we do not take any action. That is the summary, what I want to say. One word, more children will die, and that more children die is unacceptable, because a death of a child is the biggest tragedy in a family. It is not poverty or unemployment. The biggest tragedy in a family is the death of a child or death of a mother. So next I will come for the next slide. Next slide is on what is the impact of the indirect impact of COVID on children in the nutrition. So already in India, 1/3 of the children are underweight. Even in Kerala, about 20% of the children are underweight or stunted. So don't think Kerala, there is no, Kerala में कुपोषण नहीं है, वो गलत है. केरल में भी कुपोषण है. So India में 1/3 बच्चे कुपोषित है. So केरल में भी है. So that कुपोषण का वो जो malnutrition rate will increase. According to Lancet is a medical journal most respected in the world. वो है Lancet के अनुसार वो 14% कुपोषण में वृद्धि होगा, 14%. I am speaking in Hindi because there are many people from Bihar. I saw somebody from Betia.
Yes,
So
there are
I am catering to their need also. I know when I am working in an area where people may not know much of English. That's why I'm just, sorry for you maybe
no problem.
wondering.
Thank you, sir. That is okay. There are many from Gujarat, Delhi, Bihar, and so on. You can carry on.
Yeah. So इसलिए मैं तो थोड़ा ये जो हिंदी मिक्स करके बोल रहा हूँ.
Very good.
So we know in India, 70%, to be exact, 69% of the children, the root cause of child death. I said that earlier, the 9 lakh children die. But the root cause of the death of 9 lakh children is malnutrition, as per the Lancet. So if the malnutrition rate increases, then the not only malnutrition rate increases, it will affect the cognitive development. What is the problem of malnutrition is not only death, the IQ, the cognitive development of the children will also be affected, and they cannot perform very well in studies. So there are many side effects of malnutrition. So that malnutrition is already very high, 36% in India. Now it will further increase. So cognitive development, performance, everything will be affected. Second one is there is a another type of malnutrition. वो अंग्रेजी में इसका नाम है सीवियर एक्यूट malnutrition. हिंदी में इसका कहा जाता है, इसका नाम है अतिगंभीर कुपोषण. So ये अतिगंभीर कुपोषण is a serious or severe acute malnutrition is the mortality of the children is 10 times more risk of death is there. Like that, we have 7.5% of children in India. That's a large number, and they need a treatment. So there is a place called a Nutrition Rehabilitation Center, NRC. In Kerala, there are 3 nutrition rehabilitation centers. All the 3 are in Attapadi. And all the 3, I think it's in Agali, I mean, which are working, I do not know. Agali is certainly working. Yes, so all the 3 malnutrition treatment centers for treating these children are in Attapadi. So there in India, we have 1,200 such centers, but most of these centers are vacant. There is no children not coming. Now, it has the capacity to treat about 24,000 children in a month. And these children, if not treated, would die. Now, all these centers are open, but no children are coming. So you can imagine like this, if one bed is vacant in an NRC, that means you are losing an opportunity to save the life of one child. So the severe acute malnutrition, अधिगंभीर कुपोषण बढ़ेगा, वो अधिगंभीर कुपोषण बढ़ेगा तो इसका मतलब ये है more child death will be there. Another issue is anemia, वो खून की कमी. Now, खून की कमी is anemia. I mean, a problem with खून की कमी is that you will feel weakness. That's one aspect of it. For children, if you have anemia, then you will not get better concentration. So if you want to pass examination in good marks and getting concentration, children should not be anemic. लेकिन भारत में 58% बच्चे कुपोषित है, और वो जो 54% adolescent girls are also कुपोषित है, sorry, anemic है, और women 53%. 50% से ज्यादा बच्चे और ये जो लड़कियां और महिलाओं में खून की कमी है. Now, even you have the खून की, when you are having the anemia, that also leads to the malnutrition of children and the death of the children. So anemia is likely to increase because of COVID, poverty, lack of food, I mean, various other factors. Supplemented vitamin A supplementation, this is done twice every year. This has been affected because this gives immunity to the children. Vitamin A gives the immunity to the children, but that program has been affected. Therefore, the immunity of children will go down. So they will have more diseases, then they will more death, no more malnutrition, and that cycle of vicious cycle of deprivation starts. Now, what is more important is especially in the case of malnutrition is, once malnutrition happens, it damages, as I earlier explained, it damages the cognitive development, brain development, IQ, and it will stunt the height. So once malnutrition happens, it is irreversible. It cannot be, it is a lifelong. That loss is permanent. So that is in short what I want to say. ये जो कोविड का अप्रत्यक्ष रूप का वो जो दुष्प्रभाव के कारण हमारे राज्य में कुपोषण का दर ऑलरेडी बहुत ज्यादा है, वो it will increase further. Next one. Next one I want to talk about, next slide, it is on education. So in education, what has happened? We know that the education of all children have been disrupted. because of the closure of schools since March. And there are already in India, 50% of the children in class 5 cannot read even one word in Hindi or in English or in Malayalam. I'm talking about class 5. They cannot read. So learning outcome of children is already low. Now, since the schools are closed for last 8-9 months, the learning outcome of children will be affected. Then you will ask me, well, there are online learning, online classes are there, digital material is there, but this is only for maybe in Kerala or in rural areas. जो बेटिया से एक एक लड़का था, इनसे पूछिए, वो कहेंगे उधर ये इसी तरह का ऑनलाइन ट्रेनिंग या ऑनलाइन एक्सेस बिल्कुल नहीं है. So that is the second so the learning of children will be affected. Now, second point is regarding dropout. The already 60 lakh बच्चे हमारे स्कूल में नहीं है. I'm not talking about Kerala. In Kerala, all children may be in school, but in India, 60 lakh children are already not in school. With the COVID, since the children are out of school for a long time, even after schools open, they may not come back to the school. So ये जो 60 लाख का वो जो आंकड़े हैं, वो बढ़ के it could become 2 crore because many children will not come back to the school. Then when your education is reduced, then that affects the GDP, economic growth, and also individual income. It is calculated that 1 year of additional year of school education will help you to gain 10% of income. For one example, if you have only class 8, if you can get 10,000 rupees, it is calculated. Suppose if you are a class 8 pass, if you are getting 10,000, but a graduate can get double. So there are a lot of researchers which says by increasing each year of education, you can increase your income, your salary by 10%. So there is a strong connection between education and income you earn in the adulthood. ये तो एक व्यक्ति का वो जो adult life के लिए है, but it also affects the GDP of the country. So if children are not learning, if the level of education of the population in India are low, then that will affect the GDP of India, and that will lead to the more poverty. ये जो digital divide के बारे में मैंने कहा था, ये जो 76% घर में इंटरनेट एक्सेस नहीं है, ये यूनिसेफ के एक स्टडी के अनुसार only 24% of the household families in India have access to internet or any online. That means the remaining 76% are not studying anything. There is no classes for them for 9 months. They are sitting in the idle in the home. So that will affect their learning and also the economic development of the country. There is one concept called early childhood of ECD. ECD means the development of children in the age group of 0 to 6 years. This is the foundation of a child's life. So there are certain activities with respect to nutrition, stimulation, care, preschool education have to be done. Now, if that is not done, because this is the foundation of the child's health, not the child's life, and also the foundation of the country. So early childhood development has been that ECD has been affected because Anganwadi centers are closed and services for children on health and nutrition are not available. Therefore, that the foundation is shaken. Foundation, because of COVID, foundation is a little shaken now. And that will have impact on long term on the country. Next one. So next, I would like to talk about
Hello, sir. Sorry to interrupt.
Yeah.
Sir, I would like to add one point regarding education and learning. The COVID also contribute to the lack of competitive environment.
Okay. Yeah, that's also true. Yeah. Okay. Now, what is the impact on, I mean, in North India, so many of the issues I am talking may not be relevant to you. ये आप पता नहीं होगा, भारत में 15 लाख लड़कियों के शादी 18 साल के पहले होता है. 15 lakh children are every year married before 18 years. This is called child marriage. Now, whenever there is a disaster, we have globally seen whenever there's a disaster, child marriage will increase. This is not only after COVID, after every flood, earthquake in the world, we have found whenever there is a disaster, child marriage will increase. Already हमारे राज्य में 15 लाख लड़कियों का शादी 18 साल के पहले होती हैं. So that number will increase. Second one, this is already there are reports on the gender-based violence. Violence on the domestic violence on women is increasing. There is no study on it, but there are a lot of reports coming on increase in the gender-based violence. So is also the child sex abuse. According to UNFPA, additional 1.5 crore child sex abuse cases will happen. And that we know because we are reading newspaper and we see a lot of increased number of child sex abuse cases. And the calls to the child line on some reports of complaint on child rights is increased 50%. Now, online violence, when children are using more cyberspace like internet or mobile, they are more likely to be cyber violence is likely to increase. There are also reports about this increased number of online violence. Or balsram, child labor, child taskari, child short, ये सब ये जो बाल तस्करी, which means a trafficking of children and child labor will increase. We know that 1% increase in poverty leads to about 0.7% of increase. We know that poverty is increasing. We have another slide on poverty. So poverty is likely to increase by 10 to 15%. So that means the child labor will also increase by 10%. Another area is the mental health. Now, children always want activity, movement. They want to play. They want social interaction, peer support. So that is because of COVID and school closure. They are restricted movement. They are not able to meet friends. They are not, able to play. So that is going to affect their mental health in a big way. So mental health, one is affected, it will have sometimes very long-term impact on children. Not only that immediate loss of sleep or depression or anxiety or fear. These are all symptoms of the immediate symptoms, but they can have a long-term impact. We have reports of increase in the number of suicides, especially from Kerala. Children are committing more suicides. That's as per the reports. So again, the same point, children need recreation and play and movement because that's not there, that is going to affect them in long term. Next one slide is on the issue of poverty, which I just mentioned. So the COVID, the impact of COVID, the socio-economic impact of COVID will also lead to increase in the poverty. According to World Bank, about 1.2 crore more people will be pushed to extreme poverty. And the GDP, we already know the GDP growth rate of India is already in minus. When we say technically they call as contraction of GDP growth rate, but contraction means minus. So GDP growth rate to India is going to be minus 10.3. So that will, which means income is reducing. Naturally, that will lead to poverty also. In India, this is a World Bank report, but in India, we have a report that our estimate is that 22% of the people in India are poor, living below the poverty line. Now, that number is likely to increase as per one estimate from 22% to 46%, which means 35 crore more people will be pushed below the poverty line. And as per the ILO, 40 crore workers in the informal sector, their livelihood will be affected. Now there is a distinction between child poverty and adult poverty. Many people ask me, what's the difference between, because if a family is poor, normally, automatically the child will be also poor. So what is the difference between adult poverty and child poverty? There is one fundamental difference. If an adult, a grown-up person is going through poverty for some period, it is not going to affect him. He may lose some weight, which he can gain after the poverty phase is over. He will gain, and there is not going to affect him physically or in
Father Anthony,
Yeah.
voice, restore the voice, do it.
One minute. He's joining now. Some internet problem. Yes, he is joining. Sorry.
That's okay. We can hear now. Mr. Zakaria, I can do it.
Yes, he has joined. Yes, sir.
Father, sorry for So what I was telling is, the child poverty will increase. I mean, poverty is, for children is different. When children go through the poverty, the impact of that poverty is greater, and COVID is going to create more poverty for children, and that will affect their growth and the development and their income also. So this is the poverty. Now the next slide, I want to talk about what can we do. So there are many things we can do. I don't want to go into everything. First thing, as you are all youth here listening to this one, I think this is what happens when we are in a disaster. When there is a disaster, all of us join together and do voluntary work, whether it's an earthquake or a flood or an accident. What do? We come together, do some voluntary work. We have seen in Kerala, we have seen in Assam and West Bengal, whenever baad aata hai, so we come together and help. So like that, what I feel is to have improvement, to work in the area of health, education, nutrition, sanitation, and protection of children. We need a huge voluntary force. My estimate is that we need 1 crore youth volunteers in India to rebuild India after COVID, especially for children. So we have 7 lakh villages. So we need at least 10 volunteers for every village and for every urban ward and also for the urban slums. So now you will think this is all theory I am saying. So we want, volunteers to improve education of children, volunteers for improving health, volunteers for every area. Now, this is not theory what I am talking about. In Chhattisgarh, Chhattisgarh is a Maoist affected state. In the Bastar region, which is having 7 districts, is the most Maoist and Naxalite affected districts in the world. Now, in these districts, we have started 7th, just like Anamiga, we have started 7,000, not 7 or 700, 7,000 learning centers, community teaching centers, and it is run by 14,000 people like Anamiga. So there are, you imagine, there are 14,000, 7,000 वो जो forest या वो जो Maoist का वो area है, वो there are 14,000 volunteers are daily, even today, every day, 2 hours of classes are being taken by them, and they are called Sikh Mitras. And similarly, in other districts also, we are doing same thing in health and nutrition and other services. But 14,000 is not sufficient, because we need, right now we have only 2 volunteers per village. So in 7,000 villages, we have, we have only 14,000. Probably we need in Chhattisgarh itself, we need 1 lakh volunteers. So that is one area where how youth and the organizations hearing this talk can organize specific, not awareness, not on that stage is over. Now is it time for action. If you do not act upon it, it will be a tragedy. It's a calamity for the humanity. That cannot happen. Therefore, we need some action in the villages. So one is education. We have to see that at least 2 hours of education happens, because we don't have an online connection in those places. Second one, probably to ensure there is a malnutrition can be prevented. We know how malnutrition can be prevented. Same thing, how to ensure the children are immunized. So in health, we may require 1 volunteer. Nutrition, we want 1 volunteer. For other protection issues, which is with respect to child marriage, child labor, child trafficking, we will need. And we also have similar model we have set up in Chhattisgarh. So that is the, I don't want to go into other areas. Another recommendation would be that whenever people are in such a difficult situation, there has to be some scheme for what we call a social protection scheme, where, I'm not going to those technical areas. I'm giving only 1 point. Remaining points, although there are many points, I'm not discussing any points. only one point. We need a large number of volunteers to work in this area because government system alone cannot address this issue, because this is a issue of Himalayan proportion, and this cannot be done by the government system or its programs. Therefore, I said we want 1 crore volunteers who would work in different area, health, not even on livelihood. So that's over. That's all my talk. Over to you, Father Lenin.
Thank you very much, sir. Ashwati?
Father, thank you very much, sir, for allowing us. And now it's time for discussion, and you all participants can ask your doubts. You can ask to Dr. Zakaria sir, and you can share your views and contribute in this webinar. And you can also put your doubts or questions in the chat box. And those who are watching in the YouTube, you can put your questions in the comment box. Okay.
Now, a girl from Bethia
Okay.
wanted to speak from the beginning. Alisha.
Ah.
I think Alisha will speak, hopefully. Alisha, are you there? Yesterday itself said I want to talk. She must be a 10th standard girl. Okay. Anyone can speak, no problem. Anyone can ask questions or speak. We'll have a good discussion. We are at least 45 minutes. We'll have interaction session.
Sir, good evening. I am Geetanjali, District Child Protection Officer, Malappuram District.
Good afternoon.
Sir, first of all, I would like to congratulate you on a very good presentation. And we are, like us, we are child protection. We are working in the sector of child protection and also representing Women and Child Development Department. I think even each point are very important for us. Each point. It is really alarming us. And I would like to ask you, in the area of child protection, child safety and protection, what are the next year? Can you suggest some of the point of agenda for Kerala in the area of child protection and safety?
Okay. What I would suggest, at least we have some good monitoring system and reporting system in every village. Because whenever we hear about cases of child sex violence, we will know that, I mean, somebody in that village or in that apartment or somebody knew about it. So
Yes,
how to set up a good surveillance system? Somebody who would, I mean, we have to appeal to the people in the interest of the children. We are not asking them to come to the court and give some evidence. We are only just telling them, when you come against anything, any suspicious incidents of violence against children, child sex abuse or child marriage, just call 1098. They will not call, even ask you your name. You don't have to go to a court. So even such a small thing as reporting, if we can ensure that awareness in the people in Kerala and also all over the place, then half the work is done. Ek udaharan hai. Now I mentioned, the 15 lakh child marriages are happening and 100 people are attending this 15 lakh child marriage. It means about 15 crore people are attending child marriage every year. Now, as per the Child Marriage Prohibition Act, this 15 crore people can be punished for 6 months for attending a child marriage.
Yes,
but
sir.
the 15 lakh child marriages are happening, but per year, only 300, 400 cases are registered under Child Marriage as per the the report. only 300, 400. In Kerala, hardly any child marriage cases are reported. So our idea is not to send this 15 crore to the prison jail, because there is no space in Indian jails to provide for 15 crore people.
Yes.
That's not the idea. At least if people are reporting, it will have a deterrence factor. So how we can strengthen that surveillance system? I understand in Kerala we have this Jagrada. I mean, what do you call? I mean, some platform.
Child Protection Committee, sir.
Child
Protection
no,
Committees.
I'm not. I'm talking about the village level, at the gram level, at the ward level. There is nothing now.
Jagrada
There is
Samiti.
something. Jagrada Samdi. As per the
Was
ICP,
there?
yeah, all are in paper. As
Yes.
per the paper, there are 7 lakh VCPC, Village Child Protection Committee. Even in Chhattisgarh, there is a Village Child Protection Committee. This is only in paper, nobody knows about it. So forget about that, the committee. What we want is the awareness and the support from people. So we have to create a campaign. We are not asking the money. We are not asking their time. We are not asking their time in the court. We are asking for a better future of children. We are only asking them, when you have some doubtful cases in your neighborhood, in your apartment, and in all cases, if you analyze all the cases of child sex abuse or violence against children, which is happening in Kerala, you will know that at least 4 or 5 people already knew about it. And they did not report it. So if they are reporting, they don't have to go to police, because then their name will come. They have to just report on 1098. This message, if we are able to send to people, if child sex abuse is happening, I will greatly, of course, the predators have to be, I mean, condemned, and this is the heinous crime that I agree upon it. But to the great extent, the society, the community, the parents, have a responsibility, and it is because of that one this has happened. History will ask one day, what did you people do to prevent this one? So this type of the urgency we have to create in the ordinary people, that you have to report, and no liability is going to happens to you because of reporting. That's the only thing, because committees and other structures and police and those things, long term is not going to affect.
Thank you, sir.
Thank you, Giranjani.
Friends, feel free. Yeah, please carry on.
Sir, I am Joshua Vincent Gomez from Kerala. I am a first year MSW student in Malakara Catholic College. Sir,
Yeah,
anyway, it
Joshua.
was a nice presentation, sir. And I would like to ask a question. You already stated about how COVID impact on children. And I would like to ask how COVID impact on disabled children or differently abled children.
COVID, I mean, you are talking directly or indirectly?
Indirectly, sir.
So directly, there is no difference between able and disabled children. They will affect this one. As I said in the beginning, children are the worst affected, but children in vulnerable situation. So that includes economical vulnerability, disabled children. So if the children are 10 times affected, worst affected, then disabled children are 100 times worst affected. So within children itself, there are many vulnerabilities. That includes children in, I mean, there are many categories of children. So children with a disability is definitely a category which are worst affected. So we need to have a special attention on all these aspects which I mentioned, whether it's on child death or on malnutrition or on education. They will be worst affected within that category. So we have to be mindful of protecting them and giving them, for example, when we are running a community level class in a village, we have to ensure whether tribal child, there is a child from the tribal family or SC/ST community or the disabled child is included in it. So we need to have this awareness to embed these vulnerable children. I don't restrict only to the disabled children, because there are many categories of vulnerability. So they have to be taken in the plan. Whatever we do, they have to be form part of it.
Thank you, sir.
John Kabir, so could you ask directly some long question I see in the chat box?
It's yes, thank you. I'm from Tamil Nadu, working as a professor in Loyola College, Chennai. And I thought basically I'm a speaker, therefore I don't want to put my questions directly to the father because I have clearly described there are a lot of negative impact that happens to children. And what father has spoken, I've already read in the UNICEF report. So for me, it's not something new. It's just an awareness program for all of us to attend. But organizing such seminar, right? What is the intention that we are passing on to, right? People like us who attend, number one. Number second, and father very clearly insisted, right? We need volunteers, we need your time, we need your energy, step in to the ground reality. It is not just action, awareness alone, just an action. That's what he said. Wonderful. But then India today is lacking what exactly the good proven strategy to implement, go into the field, and then do wonderful services. When it comes to right responsibility of the government, what exactly we, the educators or the social workers, could play a pivotal role in bringing the resources of the government, number one. Number second, there are a lot of funding organizations. What is it exactly addressing to? Number three, right, college like Loyola and the Jesuit institutions are actually stepping into the reality, taking up social action programs. In this COVID times, what can we do exactly? Now all the rules have been relaxed. I think I heard enough. Hello?
Yeah, first point is regarding the first point.
Let me, Father, let me complete.
Okay.
And this is very clear, Father. My question is very clear. Awareness alone is not sufficient. We need to jump into action. I'm just putting forth a lot of responsibilities or roles of right institutions, the government, the social workers, people like you. I mean, invited here as a resource person, but someone who organizes a seminar. What exactly are we intending to? Are we proposing a policy level changes? Or is it just going to happen just to talk it one day and then we carry on with a lot of ideas and then one or two here and there, creating a ripple effect in their own locality? What exactly the outcome? This is how I ask in every seminar, but we fail to understand exactly where we land. But ultimately, this is creating an awareness. A lot of money is being dumped in the government. How to tap this? We have written a lot of proposals to tap the right, a lot of ministries, not approving.
So, sir, John, sir, Mr. Job, sir, will give answer. Mr. Job, sir, is not a priest.
Yeah, first
He's a layman.
point.
He will,
point.
yes, he will give answer, I suppose.
First point regarding John. I mean, you said everyone knows about it. You may be knowing, but my experience is different. Very few people know about the. I don't know whether you have. I mean, whether you have realized. I mean, comprehended the adverse impact. How it is making, even if COVID, that understanding John may be having, but 90 whomsoever I talk, this understanding, this knowledge is, this awareness is not there. So you may be having, that's a good. So only very few people have this understanding. That's why United Nations came out with a document on how it is affecting on the children. So that is the first point. Second point, see, the second point is government alone and their own government schemes and their programs and their fund will not be able to address this gigantic issue. So every agency now, for each area, I have a detailed plan of action. No, I don't have a time to discuss. For example, I mentioned about malnutrition. What each sub NGO, whether it's an NGO of the diocese or anything, what and how, I have a detailed plan of action, how they can do it. So that portion I did not cover because that will, for each area, we may have a webinar on that one. And now it is not only, I mean, in many areas, whatever I have said, it is, I want to repeat that one. It is not theory or awareness. That stage of awareness we are doing. In UNICEF, I said, we are one example I gave. Like that, we have many examples. For example, in Bastar, I don't know if Father John knows about Bastar. Bastar is the one of the worst affected in the all the indicators. In Bastar, we have 5,000 volunteers working on each of these areas. It is led by the district collector, and it is a district administration. But they need, the system cannot address this one. So if any NGO wanted to say, okay, malnutrition, we know 36% are malnourished, it has to be improved. How to go about it in one village or 10 village? What are the different steps? What needs to be done and how is to be done, and how to link it with the government? I can help them to do it. So that was not the topic, like that on each area. So at this stage, it is only on awareness on these issues, and also telling that we have to act upon, and how to act is not a vague area. We are doing, I mean, at least I am doing. I mean, all this, I mean, at least in my own limited way, we are doing. I means the UNICEF in Chhattisgarh is doing. So like that, I am in touch with the different NGOs in Chhattisgarh, because my area is only Chhattisgarh. I mean, in fact, many of the NGOs here in their own small way, because this needs resources. Now, resources have dried up because of the COVID. Even the international agencies who can support this one is dried up, and government fund also is dried up because of the revenue the revenue collection has been affected. Even the government departments do not have funds. So this is a situation where everybody, that's what the importance that we need to come into the picture. I hope, I mean, I was able to, if you ask me what needs to be done, how, what does it cost, what is the linkage, what is the academic and technical aspect of it, how will it be monitored, I can go into details on each element. So that plan I have, and we are doing it in our own way. And our own, there are many NGOs in Chhattisgarh who are doing it. So anyone who wanted to do that one, then I can help those NGOs or organizations.
Father, thank you so much. In fact, Tamil Nadu lacks this particular planning. And I don't think Tamil Nadu gets a lot of benefit from the UNICEF. And I'm a social worker, teaching as a professor in Loyola College, Chennai. But the point is, there are a lot of children, as you said, from the marginalized communities affected so much, particularly the rural community children, right? I mean, the snake catchers and the bat catchers, and these children are much affected. It is very fact. As you told us, you have every plan to reach out. If you are also ready to help out with the plan to explain or to get the resources, is something that we need to do. But exactly, we lack the ideas how to go about it. And I think I just specifically came in to attend this particular seminar just to draw this particular points so that we could go as a community and discuss and then devise our own methodology, right, pedagogy to address such program. But we lack your ideas. And
so
I think it is better.
Yeah, so probably we can have another webinar on one area, because this is a huge area. Each one, for example, even education, because it is not education involves a lot of pedagogy and technology. So what we are doing, when I said we are taking classes in 7,000 habitations, it's not that this 14,000 these volunteers go unarmed. There is a team which is developing the curriculum for it. It's a different curriculum. And that curriculum is converted into video, then the training, then the supervision, on-site support. There are many technical sides included in it. It's not that, okay, you go and teach 2 hours for everyone, not like that. So like that, in each area, there is a strategy, there is a plan, and it is a technical and scientific one, not just like a layman. For example, on malnutrition, many people, many people think just giving more food to children is the way to address malnutrition. So those are all myths. So how to go about the malnutrition, how to organize, all details we have. So we can, if you want, later, it need not be me. You can call some other expert who can tell how this can be unpacked and what does it mean, what does it cost, how long it has to be done, all this can be, I have worked out every plan. For example, if we want to do in one village with these children on malnutrition, what does it mean? How many hours of work? How much expenditure? I mean, all we have worked out. So that one, because this highest level knowledge, this looks very simple knowledge, but there is a lot of technology and a lot of science gone into it. So that we are ready to share with anyone who wanted to do.
And I think, Father, it's a wonderful feedback you have given and input. I think next, I expect where you attend this particular, where you deliver this particular plan of action, charting out a roadmap. I think I'm interested in. And I think similar organizers could probably
be bilaterally in touch, John. We will be, because we have I think UNICEF is also working with Loyola College, I think. I mean, I do not know. I think social.
Not now currently.
So, not now. So we can bilaterally talk on it. I mean, whatever. I mean, but what I want is, these this NGOs, the large number of people, because the youth. I mean, when I say volunteer, there has to be a leadership to coordinate. So all our voluntary organizations have to come. This is the time they have to come. How to do, what to do, when to do, those things we can guide. But if anybody is interested, please come. We will give you the plan of action, how to go about in details, not in a vague way.
Thank you, John, sir.
Thank you, Father.
I am Father Aline Anthony. I studied at Loyola in 2004. Okay, now I have not met you, but anyhow, thank you for your interaction. Thank you for your doubts and so on. Others can also interact. Many are there. Many may have doubt, I suppose. Mr. Job Sakriya will answer for your questions. Others, feel free to ask. You can unmute and ask.
There is one question from Mercy Matthew. She asked, it's a big concern for all of us to get volunteers to work this area are not easy. We need to insist on personal responsibility of every educated person in the society. Individuals, my answer to this one is, as an individual, it will be difficult to work in a village, in a slum, to organize, and we do not know the technical knowledge how to go about it. So this has to be marshaled under a organization which will marshal people and make this happen. So individuals, left to individuals, they have limitations on what they can do, and whatever they do should be the best interest of the child, because many times whatever you do should not lead to more harm to child by your action. So I don't think this can be individually. It is very difficult. Even for teaching a child, there's a pedagogy, there is a science behind it. So it's not so. Therefore, it has to be organized. So therefore, voluntary organization has to come in before. We have seen such a voluntary movement during the literacy campaign, 1990s. A huge literacy campaign under the different, was happening in India, across India. So something like that, we want a voluntary movement on all these areas. One question is, again, Mercy Matthew asked, UNICEF is contributing towards the training of grassroots level volunteers. At least in Chhattisgarh, we are training these volunteers. And not only, then the question will come. I mean, this is the question wherever we are. Now we have about more than 1 lakh volunteers in Chhattisgarh. So they ask these two questions. What do we get? Okay, we are volunteers. What do we get? So first thing is, we tell them you get recognition from the community. Second one, we issue them a certificate if they are really working. And in the universities abroad, and also in employment and abroad, if you show that you in the time of difficulty, if somebody has done a community work, that person is given preference. So that we will give. And there are a lot of research which says that any voluntary work benefits the person who is doing it rather than the person to whom the voluntary services are rendered. Then it improves their the skills like communication, teamwork, leadership. In fact, what we say is it will improve their employability. वो रोजगार क्षमता, वो जो हिंदी में रोजगार क्षमता है, we say that employability is low, but this skill sets they will gain through this voluntary work. So we are training many large number of voluntary organizations as well as volunteers. So we have a huge experience of training 1 lakh volunteers in Chhattisgarh. Out of that, I am not claiming that all the 1 lakh volunteers are fully engaged. At least 50,000 volunteers are engaged in one way or other, but we want more number.
Sir, I'm Geetanjali. Another issue I felt was if child poverty or adult poverty increases, will it increase the number of admissions in childcare institutions?
That is also that's also a possibility. Anyway, children who need care and protection will increase, because I quoted one statistics. If poverty is increased by 10%, then the child labor will also increase by 7, which means
0.7%.
0.7%. So that is a proxy indicator. We can say that vulnerability of the children will increase. So whether they will go to the childcare institutions or whether they will first whatever or they will remain in the home, but there is a possibility of increase in the vulnerability. So childcare homes, childcare institutions are only one method to address that vulnerability. So vulnerability will increase. So many may not go to the childcare institutions. Instead of that one, they may go for the trafficking. In Chhattisgarh, this is an organized, in North India, there is an organized networks which take children and use them in child labor and many other methods. So we cannot say no that number may not increase in the childcare institutions because of what will increase in the child labor and child trafficking and child marriage.
Okay. Sir, migrant laborers' children are also coming to Kerala. In child labor, it is in Kerala children, child labor is very low. But that migrant children coming from are a main issue in child labor in Kerala. I think it will also increase from this point of view.
Yeah, it will increase. But when we talk about child labor, we have to make a distinction. Child labor below 14 years and child labor above 14 years. Now, after the amendment of the Child Labor Act, and also because of various increased awareness, the child labor below 14 years have drastically reduced in India. Because I have worked in many North Indian states. When 10 years back, you will see a large number of children in dabas, in garages, in housemates. So below 14 years, child labor has decreased substantially. You will hardly see child labor below 14 years, very, very difficult. And I challenge, and they are very rare. But large number of children are in the between 14 to 18. Of course, that doesn't mean that there are no child labor below 14 years. I'm not claiming. But there is a drastic reduction in that number. Okay, Arya Vijayan, you can. Okay, Mootrathinte prashanam silent.
Host Mari. Vipin, could you mute Arya Vijayan?
Okay, father. Okay.
ഞാൻ ഉച്ചക്ക് പോയിട്ടില്ല, ഞാൻ പോയിട്ടില്ല.
സാർ ഒന്ന് മ്യൂട്ട് ഒഴിവാക്കിയിട്ടൊന്ന് പറഞ്ഞാൽ മതി.
Sir, unmute. Sir, could you unmute and speak?
Sorry. Yeah. So this is a big issue in Kerala. So migrant workers, children, there is a possibility. But Kerala being very, very aware of child labor, I don't think children below 15 years will be engaged in work in Kerala. But children between 14 to 18, those number may increase also in Kerala.
Sir, ഇതിൽ ഒരു ഇഷ്യൂ വരുന്നത് നമുക്കിവിടെ ഹോട്ടലിൽ നിന്നൊക്കെയാണ് ചൈൽഡ് ലേബർ നമ്മൾ കൂടുതൽ കണ്ടെത്തിയിട്ടുള്ളത്, മൈഗ്രന്റ് ലേബറേഴ്സിൻ്റെത്. അവരുടെ ഏജ് ആണ് സാർ ഒരു പ്രശ്നം വരിക. അവരുടെ കയ്യിൽ ഒരു കാർഡ് ഉണ്ടാവും, അതിലെ ഏജ് 18 ആയിരിക്കും. ഈവൻ ഇൻകം ടാക്സിന്റെ ഇൻകം നമ്മുടെ IT റിട്ടേൺസിന്റെ കാർഡ് വരെ അവരുടെ കയ്യിലുണ്ട്. 18 വയസ്സും ഉണ്ടാവും. പക്ഷെ ശരിക്കും പ്രായം അത്ര ആയിരിക്കത്തില്ല എന്നുള്ളതാണ് പിന്നെ നമുക്ക്
I don't know whether Gitanjali knows about it. In North India, it's the other way around. Most of the children who are overaged, they reduce age by 2-3 years. So I remember when I was in Bihar, my child was studying in class 10. So the principal one day called me and said, he asked me this question, what age should I write for your child? So I was perplexed. What is this question? There is a birth certificate I have given to him. So he said, no, that is all. Whatever you write is the age. And you will not believe, everyone wrote the age, some of them 13. And most of them were 16 or 17. So in North India, if you have somebody whose age is 15, normally, I mean, there are exceptions, 15 or 16 or 18, you can very well, even his age is 22. Another 3 years you can add. If they don't have a birth certificate. If they have a birth certificate, it's a different thing. If they have no birth certificate, it's on some school leaving certificate or something. Now it is changing. But earlier that was the situation. So of course, this possibility is there. But mostly the other way around. The children who are 18, they put 15. And you know there are a lot of cases in the below 15, 16 football team, a lot of cases when they do the blood test, they find, I mean, you know that there's a big controversy regarding that. But anyway, but the point is, yes, it's an issue. Children between 14 to 18, not only they are working in the hazardous industries, because we are depriving them their opportunity for education. And had they got better education, they could have got better employment and better income. So that opportunity is deprived to them, and that is deprived because of the COVID situation. So that's definitely an important point.
Father, I
So
have
there's
one
a
more
question from Mercy Thomas, says that Adi can probably orient the community volunteers and the coastal agents of Kerala.
We could think of networking and collaboration.
Yeah.
Yes, Ashwini, continue.
Okay, sir.
Shall I ask you the last question?
Hello.
Shall I ask you the last question, if I allow?
Yes.
This is to the resource person. This question is, so far we talked about children who are marginalized, neglected, abandoned, fine. But then when it comes to the middle class, and most part of the schools have conducted their, running their classes in online. And they are asked to pay the fee, parents, pay the fee in installment basis. And class notes are sent to the students, both Tamil and English medium, to their WhatsApp through the video. Either they take video by the teachers or they borrow video from elsewhere. It's being sent to the WhatsApp. My point is, and more than 25% of the children in the middle class do not afford to have the phone, but they are studied, right, well-reputed schools. They're asked to pay the fee. How the children, now we are in the educational, the educational divide, technologically most driven, both the states, Tamil Nadu and Kerala. But then children, we have many who cannot afford to have a phone for the class. And I don't think how the education will run. On one side, the resource person motivating all of us, we need your time and effort to come forward. You put your effort, you educate, and he is ready to help us. One side is very appreciated. The other side is the reality is very dismal. It is not right, very pleasant. This is who will address this? The school is not even paying full salary to the teachers. Even today, not in the beginning, even today. But children are not, children are asked to pay fully. I think this might be the case throughout India. Leave out the government schools because government is paying. The children need not to pay anything. Might be hardly few, 500 or 1,000, that's it. But then when it comes to a middle level, right, an English medium school, and I think the education is greatly affected. greatly affected. I don't know what to do. And we are addressing, when we address who are you, this question is coming. Whether your children is studying or a relative, please come and ask me. And this is how we are forbidden. Thank you so much. I am the professor, I'm not a priest. Right, thank you.
Okay, anyone, any other questions you want to? We can collect the questions together, then Mr. Job Secretary can answer to finally. Ashwini, you
Okay,
can write down.
Father.
Yeah, please ask
Another
all questions
question.
together. Ashwini?
Okay,
Yeah.
there is not much questions, but one is how UNICEF can provide support in rural development in order to enhance quality education. And okay, sir, and I have some points to add in this. I'm from Attapadi, and I'm in Attapadi. And in the rural areas of Attapadi, many tribal children are denied the online education. They lack facilities of online education. Many children lack mobile phones or TV, and still, and most of the issues are now we have reduced, and now still we have that issues. And in remote areas, children are not getting proper facilities, and I think it is also an issue. And you can add your points by how rural areas can improve the educational facilities. Please tell me.
Any other question, friend? Those who want to ask in Hindi or English or Malayalam or Tamil, feel free. I think Mr. Job Sakriya sir can understand all languages. He was the chief in Tamil Nadu, Kerala, Karnataka, Orissa, and so on. He may be able to understand and so on. John Michael, you want to ask from Mauritius?
Yeah.
Please ask.
I want to thank Joe Sakaria, sir. He presented well the post-COVID impact. So that is very important to address to this issue. So what can we do this time? So that is a very good question, and he put forward to all of us. And we have to organize a huge volunteers. Recently, we had in Mauritius. I am in Mauritius now, right now, doing my ministry here. Recently, we had a shipwreck, oil shipwreck here. So it was easy for the people when there was a catastrophe. So people organized well. The huge volunteer group come forward to save the nation, save the ocean. So we have, we have all this concern for environment. But the chronic issues like child labor, the malnutrition, when the future of our generation is somewhat attacked in many ways. So as you very well said, sir, the children they face a lot of catastrophe in their lives. I mean, we always say the children is the future generation, but we are not focusing on the child development in many ways in India, mainly in India. We are not focusing on child development, child welfare. And so when the issues like this, when COVID has a great impact, but we are not unaware of all this. This seminar really, you have presented well about the post-COVID impact on children. And people are also least care about, they pay least attention to the child care, child welfare, child development. But how to organize like Anamika has taken effort to have her own way of reaching out the children and helping the children. So today, maybe in India, when there is a big catastrophe, people come together to, even in Chennai, when there was flood, people mobilized volunteers very quickly. But the chronic diseases that we have, the children face in our country. So how to organize volunteers? People like the Anamika who take the step to to reach the children, help the children in many ways. So how to organize volunteers by themselves? So it is, should we wait for any catastrophe? But there is this unprevailed catastrophe. It's all there behind us. The you said very well. In 2-3 years, the huge impact will be on their on the children, mostly vulnerable children, and all that you said. How to start now itself to mobilize the volunteers instead of waiting for the even UN already said in August to September there will be huge cases in India, but the government did not take any effort to control COVID. It was said in April itself, India will have a huge impact on COVID. So in India, but the government did not take much effort to control. So we have in Mauritius, they have controlled in 2 months because they gave very good awareness, and we had a completely lockdown, and we used all the even now today we use mask. So, and they have closed all the airports. I mean, we don't have any international airports, no flights coming in. So we have control in 2 months, and our country is COVID free. So we have reopened all that function very normally here. Even the children, they go to school, they have their exams now. Everything is well controlled here because of the discipline. And but India has got huge population and lack a lot of volunteers organizations to make big awareness. So how to go about? You mainly mentioned on to make huge volunteers. Country like India must need that, and here also they very much with the huge volunteers, they cleared the whole country. They made COVID free, and then environmentally healthy here. People live more than 100 years here very well because environmentally is good here. I mean, the ocean they keep very clean. It's like crystal clear. Water is very crystal clear. So people throughout the world, they come here for their holidays because of the paradise. Here we have the ocean, and when it was cleaning about the ocean with oil, people had a huge volunteers. So how to mobilize Indian mind, Indian spirit, how to imbibe that
Father, I will come into
volunteer spirit. So could you enlighten us with your UNICEF, international movements? Thank you, sir.
Good point. I mean, whatever I said is based on, that's why beginning I said, it's very easy to tell theory. So many people who are listening to me may think that I'm talking about some theory. Whatever I said, of course, there was some theory evidence and was there, but whatever the examples I was telling was that we have done it and showed it. And if it can be done in Maoist affected Bastar. First of all, they are not only Maoist affected, there are no roads. There are scattered and small villages. So if you can do there, it can be done anywhere. Now, coming to the point of question, our experience, now I said, we have about 1 lakh in a small state, half of Kerala, we have 1 lakh volunteers. Now, our experience is, if you go to people and ask youngsters, volunteers are ready. If you can convince them about the urgency. See, volunteerism will work only when there is an urgency and immensity of the problem. And it cannot be a permanent solution. So if you can impress upon it, getting volunteers is not I am talking about, I don't know, Father, you know about Bastar. People in India who knows a little about and visited in Bijapur, Narayanpur, no roads, no connectivity, Naxal affected. And so that area where youngsters are ready to be volunteer. So that's not the problem. People are ready. Now, there has to be some organizational leadership, somebody coming to that field and organizing and coordinating. That one, somebody has to be there. So individual volunteer, they are ready to do, but they need somebody even what to do, how to do, somebody have to tell them. So my appeal is not to the volunteers. It is we are falling in our own responsibility. So our voluntary organization in Chhattisgarh, I wrote a letter to every organization I know. In fact, I wrote to all the 4 dioceses. So you can imagine how much work I have done. 4 dioceses in Chhattisgarh, I wrote them. Whomsoever is your NGO, please tell me, then we can guide you how to go about it, and we can also help you. Not only to the diocese service societies. I have written to every NGO. We have a lot of coalitions of a lot of NGOs and voluntary organizations. We have appealed to them. But number of people who are working, doing this one is very less. That is the truth of it. If you are expecting some money from the government for this one, probably it may not happen. Because anyway, voluntary, this 1 lakh people, not even 1 rupee is given to them. So volunteers are there. Now it is our responsibility. All the voluntary organization, foundations, we have how many, I don't know how many, we may have 1 crore voluntary organization, and it is their duty to coordinate and do it. It is not the we cannot blame the people living in those villages. They are ready to do, free. No money is required. They are not expecting. They are not even asking. So the responsibility lies with us. Now, how many are doing, even in Chhattisgarh, if I do an introspection, not many, or hardly anybody. I mean, I'm talking about the NGO sector or the civil society organizations. They are doing, but a few are doing, but not the way we want. I mean, the number and the activities that we need to do much more. Otherwise, history will ask us, you will be a big NGO, big foundation after 25 years, when the history will ask this question to us, that 25 years back, because of the socio-economic impact of COVID, this many children died, this many malnutrition happened, this many people lost livelihood, this many people, what were you doing about it? Did you do anything about it? So one day history will ask us, not because of we are very aware of the history, but even if the history is not asking, this is the time when we normally, I said, voluntary work is done when there is a disaster. We are facing that disaster. So we need a leadership in volunteering, and that the government, is ready to give their support. So wherever we are doing this, whatever activity, it is linked to the government. So the governmental system is aware of it. Whatever little way they can help, they are helping. So it is not a parallel. We are not doing any parallel work. So even so-called volunteerism have to be linked to the governmental programs and the systems. So whatever way, in many of our education programs, the teachers are coming and taking classes once in a while. Most of them are in the block headquarters or in the urban areas, but they are not in the rural areas. So sometimes they come and do. So we keep them in the loop. So whatever support they give, sometimes we take the blackboards and the pencil and the chairs from the school. So the issue is with us. What are we doing about it?
Thank you so much, sir.
Okay. Any other, last 3 questions we'll take, then we'll wind up. And it was really a wonderful session, sir. Joseph Zakaria, sir. There are many students, professors, social activists, child activists, counselors. We have a variety of people are attending this webinar through Zoom as well as through YouTube. Those who are, you can feel free to ask last 3 questions. Ashwati? You can unmute and speak.
Yeah, Sakriya sir, this is the question again from Kavya Rasu from Loyola Chennai. Look at every natural disaster, Loyola responded, but when it comes to this pandemic, we have not responded anything because we are worried about running the classes in online. And this is the case throughout Tamil Nadu, throughout the Tamil Nadu. Every institution have not stepped out of their temple of learning to reach the unreached, because all of us are, our principal very clearly said, take care, and your health is important. Be it safe. And what we want to use, take classes online, be at home. Respond to us anything that you need, that's it. And in several disasters, Loyola responded and people generously gave, and it is something very beautiful, very awesome support. But when it comes to this pandemic, which is spreading it fast, now it has come to the still almost right, very drastically has come down. But the point is, we have not done anything. To tell you honestly, we have not done anything. Loyola and all the institutions in Chennai or in Tamil Nadu have not responded anything.
So, John, my question is, why is it? I mean, that's my first question. They have not understood the gravity and the immensity of the problem. I can understand as an educational institutions because they are already engaged in the education, but I still, John, you were saying, you know, there is awareness is there. I don't think people do not know the immensity of the COVID, the indirect impact of COVID on children and the society. That immensity is there, then automatically will come. Now, I will tell an example. My brother is a well-known cardiologist, very well-known cardiologist in Thrissur. There is from Pungunnam to Purakal, there is the one stretch of this one, there was a water logged. And he, for 1 week, 8 hours, he was standing. There were some volunteers helping the vehicles to move, pushing and all this work. And he was doing it. Did anybody ask him to do? Even the volunteers who are doing it, nobody has asked them, not by the government or anybody. And people, when he was helping, nobody knew he is a well-known cardiologist in Kerala. And he is doing this work. Why did he do? Because when there is an immensity of the situation, there is a gravity of situation, we will come to that one. That is the human nature. So probably I have a feeling, John, that we have not been able to communicate to the people or organization of the gravity of the situation, gravity and immensity of the situation. We have not been able to communicate. If they knew the gravity, then there would have been action. That's my that point.
Any student, anyone? I think now I request Dr. Matthew Erthail to give a small feedback as well as order of thanks. A person who agreed to say order of thanks is not here in the Zoom. Dr. Matthew Erthail, Associate Director of ADI. He will give feedback as well as word of thanks.
Okay, I am a substitute. I do joyfully that, especially for a very meaningful presentation of Mr. Job Zakaria. First time I am seeing you and listening to you. It was a great input. Unfortunately, by the end of your talk, we lost, the electricity was lost. First time in our 15 webinars. Otherwise, even in Attapadi, we get good electricity. But here something went. I know just 5 minutes back only came back. And my mobile also was not functioning. So I was not able to get your talk. So that the question, our part was lost for me. Anyhow, but I think many interacted and they were really interested. So this was a very systematic and clear presentation with the hard data and the statistics. A talk cannot be more systematic than what you presented. Such was the impression I got. So extremely great. And the practical aspect of which I listened to just in the beginning, and you gave one after another, and about which the last part of the questions were dealing. So it was not, as somebody mentioned, theoretical alone, but practical, especially with your vast experience in India, in the various parts of India, in this field. Therefore, I think you have really motivated the participants from various walks of life, as Anthony said, and they are really seized of the seriousness of it, and what they can do. I suppose they will do what they can do. So in the name of Adi, Lokmanch and Jessa, I am really happy to thank you for these wonderful inputs, which has benefited all of us, all the participants. Thank you very much.
Thank you. Thank you.
Yeah.
Thank you for giving this opportunity.
Okay,
Thank you very much, sir.
Welcome. Yeah.
Officially, this session is ended, but still.
And I just we have to say we were the others. I thank also Anamika who inaugurated this one. We are also proud, Anamika. I don't know whether she is there now.
No, she has gone, left him.
Yeah. Thank you. Such a person from Attapadi itself, and whom Anthony has been, Father Anthony has been encouraging from the beginning. As soon as some recognition came, even before recognition, he was going there and acknowledging her greatness. That is great. Somebody from Attapadi, a tribal girl, has come up. Thank you very much. Thank you also for Joy James, who gave the presidential address. And I thank Father Anthony and the staff members, especially Bibilal and Ashwati, who coordinated this webinar. They have plenty of experience, except for this lack of electricity today. Otherwise, they did from their part very well. Thank you very much. And I thank you also Lokmanch and Jesuits in Jessa. Some of them might have attended this. Thank you very much. And we are grateful to all the participants from various parts of India and outside, especially John Michael, Mauritius, with his experience sharing with us. So let us hope, and I wish that all of you are really motivated by this talk will try to do whatever they can in their own particular situations, so that a great catastrophe, as he himself said, will be at least reduced. If not, we cannot actually remove, reduced for the children in our country. Thank you. All the best for all of you.
Thank you very much, Father Matthew Arthayil. We will have 10 more minutes. The feedback form is there in the chat box and also in YouTube. Those who are watching, those who have watched, those who attended fully can kindly fill the form, feedback form, and you will get the e-certificate. And you will be given, each one will be given e-certificate. Now, meanwhile, those who are filling, you can interact with the Job Sakriya informal way. Officially, we have finished our webinar, 10th webinar. One good news is next Wednesday, we will have webinar in Malayalam. The webinar is Samuge Yadartyavam Sambathiya Sammaranavum, Social Realities and Economic Reservation based on economy. So that is the latest topic. It is going on in Kerala, and social realities we have to understand. So next Wednesday, same time, 3 to 5, we have a great personality, eminent personality, Sunny Kapikad and so on will be the speakers. All those who know Malayalam are requested to join. Those who understand Malayalam can also join. And that is the next Wednesday. Now, you feel free to ask. I think YouTube will be, Bivin, you can put off YouTube and you can have John Michael.
I suppose Anthony Jobs, Mr. Job Sakriya is free. He is willing to remain because his time is precious.
Sir, 5 minutes, 10 minutes, 5 minutes.
ഒരു 5-6 മിനിറ്റ് നിൽക്കാം, കാരണം വേറെ പല
ഇത് സമയം കഴിഞ്ഞതാണല്ലോ. സോ പുള്ളിക്കാരന് ഇതുണ്ടെങ്കിൽ പോകട്ടെ.
So only 5 more minutes. Job Secretary sir will be there. Anyone want to ask directly? See, we have, sir, we have persons from Methodology College, Palakkad, from Mercy College, from Kerala University, Assumption Changanasheri, to so many colleges, students also, MSW students and social work students from different parts of Kerala as well as other states, and also from Bethia, Bihar, and Gujarat, Delhi. The students, environmental students, high school, +2 students, college students are there. They're watching through YouTube as well as here also they are there. Some may be happy to interact. Feel free to, if you want. Meanwhile, you can fill your form.
I just want to respond to Mr. John. Kavi Arasu is a professor.
Yes, sir, please.
Yeah.
Yeah, he told, Loyola College did nothing. I mean, it is not a disaster that we can everybody put together. It's a disaster, no, which made havoc to life. We have lost 4 Jesuits in our provinces because of COVID, and we have still 19 cases in our community. So it is the matter of life. We cannot do as other catastrophe, other disaster. No, everybody put together and work together in order to get out of this. This disaster unmanageable now at present. So, I mean, Loyola College has done a lot of things through various communities in rural places to help the poor people.
Yes, Father, I could respond. We did only for the last 2 months in the beginning, we supplied provisions to our children, to our students. We had the list. We went to their houses in Chennai. We provided only provisions. But then I don't talk about that particular aspect. I